The Molloy College nursing program is one of the best in the country, and part of that is thanks to the human patient simulator available to students. Dr. Geraldine Cornell, Rich Delson, and Debbie McWilliams are part of the sim team that works with the students as they go through the simulations.
Well, what simulation does is it provides the ability for students to either experience something that they've never experienced before. Could be a something as simple as um, a new baby being born. It could be something as critical as a code. And oftentimes, our students may miss out on these experiences in the clinical setting. So, what we try and do is we simulate, let's say, a code or a newborn baby, a delivery, and we try and simulate that in a small space with very deliberate intentions and learning objectives, so that our students can come out to work and be prepared.
Students are get a chance to be the nurse for the day. I tell them they fast forward past their boards, and now they have to take care of their patient and know what it's like to feel that intensity that a nurse at the bedside has in real life. That they are in charge of assessing that patient, and they are hopefully recognizing red flags if the patient is getting worse, and also recognizing that they improved based on what you've been doing with them.
We try to keep the simulations positive, and we tell the students when they come in that this is a safe learning environment, that they're here to, make the mistakes here instead of in the hospital. Because a mistake made here is a mistake you're not going to make when you go into the hospital. So we try to keep it very safe and very open for students to learn.
The simulation mannequins are very high tech and have been modified to fit the needs of any situation the sim team requires, from high stress emergencies to casual talk between the nurse and the patient.
What's your name? The human patient simulator is actually a high fidelity mannequin, which is connected to a laptop, can be hardwired or wireless. And obviously within the laptop is the software.
So how it works is we're connected to the mannequin through through the network, and what we have here is this is the program. It's called Leap, and it's made by the mannequin and the software, and even the viewing system is made by a company called Laerdal. And what it does is we have the ability to control the mannequin heart rate, heart sounds, lung sounds, blood pressure. We can give him seizures, change his pupil sizes, change the amount he blinks, make him stop blinking, close the eyes. We also have control of the patient monitor, which is in there. You can also see it on here.
These are incredible mannequins. They are the highest tech, very interactive. I see students really get to apply what they've been learning in the classroom to an actual clinical situation where it's safe for them to learn.
With such incredible technology, it's easy to see the simulations as the future of teaching nurses. But Dr. Cornell disagrees.
I think that it's here. I don't think that it's the future. I think it's now. And I think that the more hospitals and acute care centers, the more clinics that open up, the more home care that's required. I think the more that our society changes in terms of healthcare, the more simulation is going to be needed. So not only are we doing it now, but we will be doing so much more in the future, because we are going to have to simulate and emulate, a lot of real life situations.